I7 is a respiratory humidifier with integrated flow generator and oxygen blender that can deliver high-flow warm and humidified gases to spontaneous breathing patients. During this COVID-19 epidemic, we delivered thousands of I7 to the globe and got a lot of positive feedback, like easy operation, excellent quality, and nice service. I7 is mainly used for treatment of hypoxemic respiratory failure patients. It can reduce the need for intubation and fatality rate, precisely control oxygen concentration, flush out dead space, promote oxygenation and carbon dioxide elimination, create a positive airway pressure to enhance lung recruitment. It flows up to 80 liters per minute, and oxygen concentration is from 21% to 100%. The big range of dew point temperature setting is from 29 to 37 degrees Celsius that can suit more patients with heat intolerance. Blood oxygen module as an option is very convenient for clinicians to learn the patient conditions. The unique front cover design isolates the heating system of the machine from the outside and improves the heating effect of the machine. It also reduces the risk of hand burn by the hot humidifier chamber. I7 with so many features and user-friendly design will be your next HFNC product. I7 is a respiratory humidifier with integrated flow generator and oxygen blender that can deliver high-flow warm and humidified gases to spontaneous breathing patients. During this COVID-19 epidemic, we delivered thousands of I7 to the globe and got a lot of positive feedback, like easy operation, excellent quality, and nice service. I7 is mainly used for treatment of hypoxemic respiratory failure patients. It can reduce the need for intubation and fatality rate, precisely control oxygen concentration, flush out dead space, promote oxygenation and carbon dioxide elimination, create a positive airway pressure to enhance lung recruitment. It flows up to 80 liters per minute, and oxygen concentration is from 21% to 100%. The big range of dew point temperature setting is from 29 to 37 degrees Celsius that can suit more patients with heat intolerance. Blood oxygen module as an option is very convenient for clinicians to learn the patient conditions. The unique front cover design isolates the heating system of the machine from the outside and improves the heating effect of the machine. It also reduces the risk of hand burn by the hot humidifier chamber. I7 with so many features and user-friendly design will be your next HFNC product. I7 is a respiratory humidifier with integrated flow generator and oxygen blender that can deliver high-flow warm and humidified gases to spontaneous breathing patients. During this COVID-19 epidemic, we delivered thousands of I7 to the globe and got a lot of positive feedback, like easy operation, excellent quality, and nice service. I7 is mainly used for treatment of hypoxemic respiratory failure patients. It can reduce the need for intubation and fatality rate, precisely control oxygen concentration, flush out dead space, promote oxygenation and carbon dioxide elimination, create a positive airway pressure to enhance lung requirement. It flows up to 80 liters per minute, and oxygen concentration is from 21% to 100%. The big range of dew point temperature setting is from 29 to 37 degrees Celsius. That can suit more patients with heat intolerance. Blood oxygen module as an option is very convenient for clinicians to learn the patient conditions. The unique front cover design isolates the heating system of the machine from the outside and improves the heating effect of the machine. It also reduces the risk of hand burn by the hot humidification chamber. i7 with so many features and user-friendly design will be your next HFNC product. i7 is a respiratory humidifier with integrated flow generator, an oxygen blender that can deliver high flow warm and humidified gases to spontaneous breathing patients. During this COVID-19 epidemic, we delivered thousands of i7 to the globe and got a lot of positive feedback, like easy operation, excellent quality, and nice service. i7 is mainly used for treatment of hypoxemic respiratory failure patients. It can reduce the need for intubation and fatality rate, precisely control oxygen concentration, flush out dead space, promote oxygenation and carbon dioxide elimination, create a positive airway pressure to enhance lung requirement. It flows up to 80 liters per minute, and oxygen concentration is from 21% to 100%. The big range of dew point temperature setting is from 29 to 37 degrees Celsius. That can suit more patients with heat intolerance. Blood oxygen module as an option is very convenient for clinicians to learn the patient conditions. The unique front cover design isolates the heating system of the machine from the outside and improves the heating effect of the machine. It also reduces the risk of hand burn by the hot humidification chamber. i7 with so many features and user-friendly design will be your next HFNC product.
Good morning, good afternoon, and good evening, everyone. I am Mary Nie, Clinical Application Specialist from EMED and Higher International Marketing Department. Warmly welcome and thank you very much for your attending our webinar focused on the high-flow oxygen therapy clinical application. I understand 2020 is not an easy year for almost every single people on this planet. With supplying more than 50,000 units of ventilators all around the world, our company is trying our best to help people as many as possible, and we are always standing still on our promise to our society. God life sincerely. EMED is the only manufacturer in China that fully covers all the different kinds of ventilators, including high-flow therapy, emergency, transport, ICU treatment, and home care ventilators. Supplying comprehensive comprehensive solutions for patients from mild to moderate and severe and critical. More than 1,500 units of high-flow respiratory humidifier neo-high-flow I7 are spread to cure more and more patients. Today, we're more than happy to have our Professor Wang Yibing, the Director of ICU, Chief Physician of Department of Critical Care Medicine of Beijing University 3rd Hospital at Haidian area. Professor Wang is also Executive Director of Beijing Physiological Science Association and Chairman of Professional Board of Critical Care Medicine. Professor Wang will share his academic opinion on the high-flow oxygen therapy. Next, I will give the time to our Professor Wang. Enjoy it. Okay.
Hi, good afternoon and evening. It's my pleasure to come here to discuss with you about humidified high-flow nasal cannula oxygen therapy and CPAP. Let's review simply about respiratory anatomy, respiratory system anatomy. As we know, the larynx separated the respiratory tract into the upper respiratory tract and the lower respiratory tract. In the upper respiratory tract, the function of nasal and nasal cavity is filtration, humidification, and warm up. They warm up the cool area, inhale into the airway first. The lower respiratory tract bronchus have a totally 23 grade, and there are 300 and 400 million of pulmonary alveoli. Below the grade 6 are bronchioles. As we know, if we want suction of sputum, the suction tubing or bronchoscopy only can insert into grade 3 or grade 4 bronchus, cannot reach the deeper bronchioles. If we want to move the sputum out of the airway, we should try to move the sputum by cough, move the sputum into the main bronchus, then can be sucked by suction tubing. I like to talk some items. The first is why we need humidification. As we know, in normal situation, our airway water loss is huge. We lost the water from airway about 800 to 1,500 milliliter in 24 hours. If the patient have fever or artificial airways, the water loss will be much more than 1,500 in 24 hours. Let's say the traditional oxygenation system. In this bottle, there are about 100 to 200 milliliter water. Our doctors and nurses know if we want to evaporate all of the water in the bottle, will take at least 3 to 5 days. So we consider the regular nasal cannula and the venturi mask are almost without humidification. So if we cannot get a satisfactory humidification, the sputum will become scarred. It's difficult to be removed from the respiratory tract. How about a nebulizer? As we know, the nebulized fluid are molecular classed. This class is not small enough that cannot reach the end of bronchioles. So it's difficult we use nebulized technique to make the sputum become softer and thinner. The humidification is very useful. They can evaporate the water molecules. The water molecules can reach the end of the bronchioles. So we can make the sputum at the terminal bronchioles become softer and thinner and easy to be removed. The third, let's try to answer the question. What's the first principle of anti-infections? One answer is reasonable selected antibiotic based on the drug sensitivity test. Is this answer right? Let's consider some situation like abdominal infection, peritoneal abscess, cholecystitis, brain abscess, lung abscess, and lung infection. Can we control this kind of infection by use antibiotics only? The answer is no, because we should first do some operation and drainage abscess first, and the antibiotics just play the helping role. So the correct answer is the first principle of anti-infection is drainage. In generalized concept for lung infection, the most important treatment is removing sputum. If we want removing sputum, the first step and the basic condition is satisfactory humidification. The humidification make the sputum become softer, thinner, and easier to be removed by cough. What is the satisfactory humidification? We can observe from 3 points. The first point is the satisfied humidification should let the water become saturated steam. So humidification temperature in human body should close to the body temperature. So the temperature at the center should be 34 to 37 degrees centigrade. The second point we can observe the humidification is water consumption. The water consumption should be more than our natural evaporation from airway. So the water consumption should more than 1,000 to 1,500 in 24 hours. The third point we observe the humidification factor is sputum becomes softer, thinner, and easier to be removed by cough. So our nurses know the basic airway nursing is turned over, knock back, and sucked sputum. That based on satisfactory humidification. Another item I like to talk is why we need high flow. To prevent airway water loss, we should keep all inhaled air is well humidified, should be saturated steam, but this will tend to have to calculate inspiratory flow. For example, if the patient's respiratory rate was 20 ppm, IE ratio was 1 to 3, tidal volume was 500 milliliter. Let's calculate what is minimum inspiratory flow rate to meet the patient's need. Because the patient's respiratory rate is 20 times per minute, so every breathing cycle is 3 seconds. Inspiratory time is 1 second because the IE ratio is 1 to 3. The tidal volume is 500 milliliter should be per second. So multiple 60 seconds. So the flow rate should be 30 liter per minute. But this is only average flow rate. As we know, the peak flow rate of the patient will be much higher than the average flow rate. So the peak flow rate usually much higher than 30 liter per minute. So the high flow oxygen system should give 60 to 80 liter per minute. Our regular oxygen system only provide low flow rate of oxygen. It's about 1 to 10 liter per minute. We know this is not far from enough to meet the patient's need. Let's see all the humidified high flow nasal cannula system. Here is a flow meter. Provide 8 to 80 liter per minute flow. This 8 usually suitable for infant. The 80 liter used for adult. The air oxygen blender can provide room air to 100% oxygen, and the humidifier can heat in the water to the 34 to 37 degrees centigrade evaporation water. What is a core principle of correcting oxygen exchange disturbance? How to correcting the hypoxemia? The basic principle is open the lung, keep lung open. So we can use the continuous positive airway pressure. We usually call CPAP. When we use the CPAP, the patient should have a spontaneous breathing. This system can provide high flow rate of oxygenation, can provide continuous positive airway pressure during all breathing procedure. This CPAP can reduce the workout breath, and the tidal volume and the respiratory rate determined totally by the patient. So patients will feel very comfort, not like to use a ventilator. The patient need to trigger the ventilator. So sometimes the patient will feel not so comfortable. But the CPAP, usually patient will feel very comfortable. This is the CPAP system. The different from the cannula nasal system, we change the cannula into the mask, face or nasal mask. Other part of the system are same to the nasal cannula system. This is the mask of the CPAP. This tubing is send humidified high flow air mixed with air and oxygen sent to the patient. If we want the patient cannot produce negative airway pressure, we should give enough airway flow rate to always keep the PEEP valve open. Let's see the difference between CPAP and the PEEP. As we know, the PEEP is usually used in the ventilator support. The CPAP used in the spontaneous breathing, because when we breathing spontaneous, our airway pressure will have negative phase and a positive phase. But when we use a ventilator support, all of the airway pressure are in positive phase. So we only can keep the expiratory and expiratory pressure in positive, that we can keep all of airway above zero, keep the airway pressure is positive. This is a ventilator support. But if we have a spontaneous breathing, we should give some pressure and elevate the baseline of the respiratory baseline. So let the airway pressure keep on the positive area. I like to introduce a sequential stepped respiratory support concept. This concept was raised in recent 10 years. We have a traditional nasal cannula and a venturi mask. That's the regular oxygenation system. But in many situations, this oxygen system cannot meet the patient's need of oxygen supply. So if this system doesn't work very well, we should use a humidified high-flow nasal cannula system and plus the CPAP. This can resolve some patients' need. If this HFNC cannot resolve the patient problem, so we should use non-invasive ventilation support. So that's non-invasive positive pressure ventilation. So, if the non-invasive ventilation cannot meet the patient's need, we should do some catheter intubation and use the ventilator, use the invasive positive pressure ventilation. So this is a step by step to use all of our ventilation support. As we know, as we have talking before, the traditional oxygen supply system cannot have a humidifier and cannot provide enough flow rate to the patients. So some doctors suggest in recent year to replace the traditional oxygen system with high flow rate nasal cannula system. Let's compare the high flow system to the non-invasive ventilation. Because non-invasive ventilation, the patient need to connect to the ventilator. So at the non-invasive ventilation, the patient need for coordinate with ventilator. But in a high flow system, the patient need not coordinate with the ventilator. So the patient will feel better comfort. The respiratory rate and the tidal volume was determined by the patients. So this is very good for patients to cough and airway protection. But in non-safe invasive ventilation system, because the ventilator sometimes, if we give it too much higher condition, will injure the patient's lung. So we should carefully to use this system. So high flow system will be better for mild patients. The clinical value of a humidified high-flow nasal cannula oxygen system. The first is airway humidification. just now we have discussed that the humidification can protect mucosal barrier for respiratory tract. This humidification can help clear airway secretion, so can improve the ventilation and improve the carbon dioxide retention, and remove the sputum can help us overcome the lung infection. The second, the clinical value of a humidified high-flow nasal cannula is the oxygen therapy at the right concentration. As we know, as COPD patients cannot be given high concentration oxygen. Traditional oxygen therapy have a problem because they usually give a pure oxygen. So if we give the flow rate too high, this will inhibit the COPD patient's respiration. So if we give a too low flow rate oxygen, that will not enough humidified volume that cannot meet the the patient respiratory tract. In ARDS patients, like COVID-19, we need high flow and a high concentration of oxygen with a high volume of humidification. So this clinical value is very useful for our ARDS patients, especially for COVID-19 patients. The third point of a clinical value is open the lung and keep lung open, because we can compare with a CPAP system connect to the high flow rate system. High flow oxygen reduce the workout breath and can keep lung open. That will improving oxygen exchange, especially in COVID-19 patients. I like to introduce Chinese expert consensus on clinical application of humidified high-flow nasal cannula oxygen therapy in adult. This was published in 2019. The first is indication. What kind of patient suitable for use this technique? Use a high HFNC. The first, the mild or moderate type 1 respiratory failure patients suitable for use a high flow rate nasal cannula. And the mild respiratory distress, the respiratory rate below 24 times per minute. So this is mild or moderate ARDS, like mild COVID-19 patients. So we suggest if the COVID-19 patients at the very beginning is a mild, low oxygenation index below 300, but over 100, we suggest the patient use high flow nasal cannula system. And HFNC can also used in the mild ventilatory function, the pH over 7.3. So if the patient intolerant the non-invasive ventilation, so it also can try to use the HFNC system. What's the relative contraindications? What kind of patient may not suitable for use in high flow nasal cannula? The severe type 1 respiratory failure, like oxygen index below 100, usually we do not suggest use a high flow nasal cannula. And ventilatory dysfunction, pH below 7.3, and have a contradictory breathing, and poor airway protection, we don't suggest use the high flow nasal cannula. The absolute contraindication is we have done cardiopulmonary resuscitation patients, because this kind of patient do not have spontaneous breathing. They need intubation and invasive medical ventilation, mechanical ventilation. So we cannot use a high flow nasal cannula. If the patient have an extremely severe type 1 respiratory failure, like oxygen index below 60 in severe, like COVID-19 patients, so we do not suggest the patient use this technique. So the clinical application of humidified high-flow nasal cannula, well, we summary is: 1, HFNC is suitable for acute type 1 respiratory failure, severe pneumonia, mild ARDS, like early phase of COVID-19, and other type of respiratory failure. Second, this also can be used in ventilatory weaning patients, like weaning of a critical ill patient in ICU, weaning of the patient after surgery. They can also use the high flow nasal cannula. And the 3 point is some type 2 respiratory failure can also use the high flow nasal cannula, but should be very careful, because this technique only being suggested as the complementary therapy during the break of non-invasive ventilation, or as alternative to non-invasive or controlled oxygen therapy. This is a flowchart of a clinical application of a high-flow nasal cannula in acute respiratory failure. This graph we like I talked before, only suitable for mild and moderate respiratory failure. If the patient becomes severe respiratory failure, it's not suitable. So another application is for extubation patients. If the patient have a tracheal intubation, use invasive ventilation. After patient weaning from the invasive ventilation and extubation, we can try to use a high-flow nasal cannula to this kind of patients. I like to introduce some study related to the high-flow nasal cannula technique. This paper came from French. Use nasal high-flow oxygen during acute respiratory failure. We can see the flow rate become higher. The airway pressure will become higher, will increase the end expiration lung volume, and will recruitment some lung unit. Will recruit some airway unit. So the lung compliance will become better. This high-flow oxygen system can also provide a higher FiO2. So this can increase the artery oxygen pressure. Also can reduce the dead space of the lung and can benefit for clearing carbon dioxide. All of these effects will decrease respiratory drive and reduce the respiratory rate and reduce the work of breath and respiratory effort. So will let the patient become more comfort. So adequate humidity will also make the patient comfort. This study also came from French. It's a high-flow oxygen through nasal cannula in acute hypoxemic respiratory failure. We can see this red line is a high-flow system. We use a high-flow system will reduce the intubation of the patient will much lower than non-invasive ventilator and the standard oxygenation system. This also use the high flow system can also reduce the ICU days of the patient. Another study came from Thailand. Use of a high flow nasal cannula for acute dyspnea and hypoxemia in emergency department. So we can see the high flow nasal cannula can have a much lower dyspnea scale than the regular oxygenation technique. So this study came from the China, Wuhan. High flow nasal oxygen in coronavirus disease. This is a COVID-19 patient with acute hypoxemic respiratory failure, a multi-center retrospective cohort study. This is a multi-central trial. The conclusion is early use high flow nasal oxygen may be an effective respiratory support modality for COVID-19 patients with mild to moderate acute respiratory failure, and its use may reduce the need of tracheal intubation. So, in summary, the clinical application of high flow nasal cannula well suitable for the patient who need humidification and oxygen therapy. It should be considered as a better choice as the early stage of oxygen therapy. So more and more doctors suggest the high flow technique should replace the traditional oxygen absorbing modifying bottle. And the high flow technique plus CPAP will suitable used for ARDS hypoxemia patients. For example, like COVID-19 patients can control the disease earlier. Greatly reduce the patient's chance of intubation and using ventilation. Thank you very much.
Yep, I'm back. I'm Mary here again. And many thanks to our Professor Wang. He has a very professional and very detailed presentation about our HFNC, especially used not only on the COVID-19 patients, but also he talked about more and more like the type 1 acute respiratory failure, IG, COVID-19. And also there are so many articles and other benefits in this presentation. And thank you, Professor, very much for your excellent presentation. And actually, I do have a question for our professor. And I see there are some articles talking about the if we're using the HFNC, probably our health workers, like our doctors or our nurses, will it be very dangerous for them to use this?
For dangerous for what?
For our doctors or
Nurses.
nurses. Yeah.
This is a good question. But in regular patients, not infection patients, it's not dangerous for everybody. But if in COVID-19 patients, sometimes the nurses worry about this technique because this system is an open system, not a closed system, not like the ventilatory system, invasive ventilator. This is a closed system, so it's easier to be to protect the nurses and doctors. But in the high flow system, it's an open system. Sometimes the nurses will worry about it. But I saw some article, some paper, they have some resolve method to protect the nurses and the doctors.
Yeah, because I also saw the articles, no matter from Italy or from China or even Detroit, US, they find that actually for the patients and for our doctors and nurses, there is even lower dangerous for our health workers to use this one to take care of our patients. So I think not only the HFNC could benefit our patients, but also depends on these articles. It's not a more dangerous way to
normal, because key point is the protection of our nurses and doctors' airway tract.
Yeah, exactly.
That's if we take the closed mask carefully, it's dangerous and no more than other technique.
Yeah, exactly. And I think that's almost for today. And thanks our Professor Wang again. Thanks for his professional presentation. And also thank you for all of your coming. Thank you for all of your time. And also tomorrow, let me see, GMT +8 Beijing time, 16:30 to 17:30. Also, we will have our Professor Wang to have another discussion about our HFNC, especially towards to our doctor friends and our nurses friends. And thank you very much for your coming. And it's time to say bye-bye and wish all of us stay healthy, stay safe.